Have you ever stopped to think that when it comes to your health, your postcode might actually matter more than your genetic code? It sounds kind of crazy, right? Well, today we're going to dive into exactly that. We're exploring the absolutely staggering health divides that exist all around us, and we're going to uncover the real reasons why where you happen to live, work, and play can literally determine how long you live.
So let's just start with a number that should stop you in your tracks: 17. 17 years. Within the European region alone, the gap in life expectancy between the healthiest and least healthy countries is a shocking 17 years for men. I mean, think about that. That's almost 2 whole decades of life.
And this just begs the question, right? How is it even possible that two people born on the exact same day in the same part of the world can have such wildly different chances for a long, healthy life? The answer? Well, it isn't simple, but it is something we can understand.
To even begin to get our heads around this, we first need to grasp just how huge this problem is. We're not talking about small statistical blips here. We are talking about a massive, truly shocking health divide.
Okay, so look at this. This data shows something really important. This isn't just a simple story of rich continents versus poor ones. Even inside a relatively wealthy area like Europe, you see these enormous gaps in life expectancy from one country to the next. And these differences, they are not random. They reflect really deep social and economic divides.
And get this, the divide doesn't just exist between countries, it's happening inside them too. Just take a look at this chart from Sweden, a country we all think of as having a really high standard of living. It shows a clear gap in how long people live based purely on their level of education. This is a perfect example of what's called the social gradient in health. Basically, the higher your socioeconomic status, the better your health gets, step by step, all the way up the ladder.
So here's the crucial point. We're not talking about unavoidable biological destiny here. We're talking about something very specific: health inequities. The World Health Organization defines these as systematic differences in health that are avoidable through reasonable action. In other words, these gaps are unfair, they're unjust, and most importantly, they are preventable.
Okay, so that leads us to the next big question. If these inequities are preventable, then what's actually causing them? Well, to find the real answer, we have to look way beyond the walls of doctors' offices and hospitals.
The reality is, our health is shaped so profoundly by factors that have almost nothing to do with our personal choices or even whether we can see a doctor. These are often called the social determinants of health, and they are the true root causes of the inequities we've just been looking at.
This classic model helps us picture how it all works. Think of it as layers. At the very center, you've got individual things like your age and your genes, but wrapping around that, you have your social networks, your friends, your community. And then a bigger layer outside that is your living and working conditions. The quality of your housing, your education, your job. And all of that is shaped by the huge overarching socioeconomic and environmental conditions of the society you live in. Each layer has a massive influence on the one inside it.
And if you boil it all down, you get to this really powerful statement from the WHO Regional Office for Europe. At the end of the day, inequities in health are caused by the unequal distribution of power, income, goods, and services. It's that imbalance that creates the conditions for poor health to fester in some communities while others get to thrive.
Okay, so the problem is huge, and the causes are complicated. I get it. But it is not hopeless. Not at all. In fact, there is a clear blueprint for how we can start to build a fairer, healthier society for everyone.
The source material lays out 4 essential steps for any government that's serious about fixing this. First, you've got to get political commitment and get different departments working together. Second, you figure out what the problem really looks like and where you can actually make a difference. Third, you assign who's responsible, and, this is the big one, you give them the resources to actually do the job. And finally, you draw up a detailed plan with clear goals.
Now, I know that might sound a little theoretical, so let's look at how these ideas are actually being put into practice. Let's talk about some real-world examples of change.
So Norway has developed one of the best national strategies out there, and they use this brilliant river analogy to explain how they do it. They tackle the problem at 3 different points on the river: upstream, midstream, and downstream. So what on earth does that mean? Well, upstream actions are the big picture social reforms, things like fair tax policies and great public schools that shape the whole society. Midstream is about reducing everyday risks, like making sure workplaces are safe or creating healthier neighborhoods. And downstream is about helping people who are already sick, providing targeted health services to lessen the impact. The key is you absolutely need all three.
Now check this out. This is a really smart idea called proportionate universalism. A normal universal approach just offers the same service to everybody. For instance, smoking cessation clinics are open to all. But proportionate universalism is cleverer. The services are still for everyone, but the scale and effort are ramped up for those who need it most. So, using the same example, you'd put extra money and staff into the clinics in the most disadvantaged neighborhoods where smoking rates are highest. It's about universal support, but in proportion to the need. Brilliant.
So where does all this leave us? Well, it leaves us with a pretty clear path forward, and a call to action that really applies to every country, no matter where they're starting from.
The message is actually pretty simple. For countries that have very few policies in place to protect people, the first step is to just do something. The evidence is clear that even small improvements, any action to improve social rights or social spending, can lead to real, tangible improvements in health.
Now, for countries that already have some of these protections, the challenge is to do more. This means making those existing systems stronger, making sure that every single person can reach a minimum standard for a healthy life, protecting them if they get sick or lose their job.
And finally, for the wealthiest countries, the ones with advanced systems already in place, the call is to do better. This means you have to actively work to reverse the trend of rising inequality by making those great systems even stronger and adding extra targeted programs for the people who are most vulnerable. Which, brings us right back to where we started. The conditions that shape whether we are healthy or sick are all around us, every day. So the final question I want to leave you with is this. Look around your own town, your own neighborhood. What are the things that shape health right there, in your community? Because understanding that, that's the very first step to changing it.